Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo. Hello, and welcome back to the Our Forever Smiles Cleft Mom Diaries and Support podcast. I am Laura Arroyo. Before we jump into this episode, I'd like to invite you to join this community to hear conversations with other cleft moms and advocates that will help you feel supported along your journey. All I want you to do is click on the follow or subscribe button. We love your support, and thank you so much for subscribing. We have so much in store for you this year. As a note, we do have a medical doctor on the podcast today, but she is not your medical doctor, so we do not intend for you to use the information that we share here as a diagnosis or personal medical advice. We are parents and advocates who love our children, and we are sharing our own personal experiences. Today, I am so excited because, as I've shared, we have a doctor on the podcast today. Dr. Kanth is a board-certified plastic surgeon and fellowship-trained pediatric plastic and craniofacial surgeon. She is co-director of Rutgers Health Cleft and Craniofacial Program at Bristol Myers Squibb Children's Hospital in New Brunswick, New Jersey. And she's also a mom of an amazing 2-year-old. And yes, we are so excited to have her on. Welcome, Dr. Kanth.
Awesome. Thank you so much for having me. I'm really excited.
So I'm so excited to have you on because I want to have like more doctors and more professionals come on the podcast to kind of, I feel like we do a lot of crying and, you know, a lot of expressing ourselves as parents, but I think that there are also parents and moms who are looking for, I don't know, maybe that clinical like affirmation from, you know, professionals and doctors that are kind of like sharing their experiences. But also, I just wanted to talk a little bit about what the profession like is. So just in reading your bio, it says fellowship trained pediatric plastic surgeon, craniofacial surgeon. So I guess, what do you have to do to get kind of like that stamp? Like, what does that entail?
Absolutely. Yeah, I know it's a lot of titles, but so basically, you know, after college, I went to medical school. And so that was, it was 4 years. And in that time, you kind of decide what kind of doctor you want to be. And I actually kind of fell into plastic surgery. I was very lucky to find it. Even kind of, you know, within the medical profession, you sort of think of plastic surgery in a certain way, in the way that it's kind of portrayed in the media, which kind of does, you know, focus a lot on, you know, the aesthetic aspect of it. But there's also this whole, you know, reconstructive aspect of it that really is more me. And so I actually, the case that I happened to, you know, be assigned to one day was this, you know, breast reconstruction. And this woman, after cancer, and a woman, you know, she left the operating room having, you know, new breasts. And I felt like it was God's work. And I was like, and, you know, that's like sort of the essence of plastic surgery, which is kind of to make whole what either fate or circumstance has taken away, is what our quote is.
Yeah.
And so at first I was really gung-ho about, you know, breast reconstruction, and because I wanted to take care of women and I wanted to help women in that way. And then, so I was lucky enough to match into plastic surgery residency, which is a 6-year training process after medical school. And in that, you get to explore all of the facets of plastic surgery, and they're all wonderful. But I felt the most connected in the craniofacial clinic, the Cleft Craniofacial Clinic, because I felt like I had a knack with the patients and the families. Like, I loved to take care of the children. I also loved to take care of the families. It was like just a really wonderful thing. It was so healing for everybody. And then also, you know, from a technical standpoint, which is not what this is all about, but it matters. Like, it's also very interesting to think about these problems in 4D. So not only like, you know, 3D, which is like the reconstruction, but how is it going to go with age? How is it going to go with the circumstances of, you know, this individual patient and their family and their circumstances? So it's just a lot of critical thinking, and it really matched me as a whole. And so then after my plastic surgery residency, I was lucky enough to match into a craniofacial fellowship, which is an additional year where I gained training in that. And then I was able to to start my career as a pediatric plastic and reconstructive surgeon.
Hi, I am so sorry to interrupt the show, but I just want to tell you about today's sponsor. Today's show sponsor is Sienna Darn Media Integrated Marketing Agency. Sienna Darn Media is more than just a marketing agency. They are your partners in progress. Their mission is simple: to alleviate marketing bandwidth, allowing creative business owners to focus on what they set out to do: create. Sienna Dawn Media empowers creatives to thrive without the burden of managing their own social media and marketing campaigns. Visit siennadawnmedia.com. Do they give, like, is that, so you can start in plastic surgery and then if you want to pursue like craniofacial surgery after you could, or you have to kind of, well, you got to match into a program. Is that how that works?
Pretty much, yeah. So yes, during your time in training, you then have to kind of apply to the programs that supply training in cleft and craniofacial surgery. It is a match process, which is how it works for pretty much all aspects of medicine almost, in which you kind of submit a list of your top places and all the places kind of submit their list, and it's an algorithm, and you open up an email one day and they say, you've matched into this place. And it does work, or at least, it's worked for me, because it means like me and the place both kind of liked each other. So
Yeah.
it works, even though it's a little anxiety provoking, as one can imagine.
Yeah, I can imagine.
That's yeah. So if suppose, one was not able to match into a program one year, they could always reapply, So it doesn't mean that door is closed forever. It just means they would try again in the next cycle.
That's so interesting because, I kind of understood like the whole matching thing. I think it happened recently, right? The rounds or whatever happened because I saw online that people were matching. Yeah, and that's so cool. The thing that I didn't know is because there's different buckets, right? Because there is this whole bucket of plastic surgery, and there are different types of plastic surgery, as you've shared, that you could do within that, I guess, what you call it, like a discipline or something, or area. And so you would match there first, and then you could do, is that optional? Like you could do an additional like year of craniofacial, like specific training?
That's right. Yep. So if you wanted to have additional training in addition to being a board certified plastic surgeon, because after you become a plastic surgeon, you have this whole process of also taking the boards to be board certified. But if you also wanted to specialize further into something like hand or craniofacial surgery, or microsurgery is this specialty where you do complex reconstructions, taking tissues from one part of the body to other parts of the body, you would do an additional year of training in most cases to do that. You don't have to, but I do think it's helpful to take a year to get that additional sort of extra expertise. It's like nothing kind of works better in my mind than having experience.
Yeah.
So just having a year of just really tailored experience is really a lot of growth.
Yeah.
Kind of in that field.
Can a doctor do cleft surgery without being cleft, like without this experience?
One absolutely can, but I think many don't. So you also don't have to be a plastic surgeon to be a cleft surgeon. It's possible to do that additional kind of fellowship outside of, for example, oral surgery training, or ears, nose, and throat training. There are kind of fellowships through those pathways as well. But mine was through the plastic surgery pathway.
Yeah. Huh, that's so interesting because, one of the things that I feel like I've shared this as well. So our doctor, my daughter's doctor, her surgeon actually left the practice, and then she was not replaced, but then the doctor that was at the hospital was the ENT that was at the hospital. So she was performing surgeries. She is now performing surgeries at the hospital. And it confused me because we had a doctor, and my daughter had palate repair, and then when she had
Yeah.
palate repair, her tubes were placed during that time. And when her tubes were placed, I have a list of all the doctors that did everything
Mhm.
during that time. I had a list of doctors that were doing her performing whatever procedures at the time. And so I saw the doctor's name, and then I said, she's the ENT who placed the tubes. And then, because I
Mhm.
keep up with the clinic because she's still a patient there, I noticed she was now doing surgeries, and it confused me because I said, why is the ENT doing the repairs now? But then I was
Mhm.
made aware that they can certainly do repairs. And so that was like so confusing for me because there was another patient that contacted me that is at the hospital that we are at. And she said, oh, this doctor is doing my daughter's repair. And I said, that can't be true because she's the ENT.
Mhm, mhm. Yeah, yeah, I could see how it could be very confusing, but yeah, as long as the surgeon, has the additional training and sort of that's absolutely a pathway to being a cleft surgeon. I'm not sure what the most common sort of pathway is. I think it would
Ah,
be plastic surgery.
yeah.
I'm in my own kind of bubble in that way, so I'm honestly not sure. But yeah, I think the important thing is having a surgeon just who has the training and the experience and who's busy and obviously who cares about the outcomes deeply,
Yeah. Yeah, I
things are
think
important.
so as well. I was curious about that too, because then, so would the likelihood would be like the ENT would also have this additional craniofacial training? Is that
Likely, yeah.
likely?
Uh-huh.
Okay.
Most
Okay.
likely.
Yeah, that's okay. That makes a lot of sense. What do you think is your favorite surgery to do?
Oh man. I mean, yeah, I mean, you can't beat a cleft lip repair just because it is a small surgery that makes such a big impact. I would say that the kids generally do well, and it's a huge transformation, and so that's definitely my favorite.
Yeah. Yeah, I've heard that a lot. Like all the surgeons that I've asked says the lip repair.
Yeah,
And for that same reason, it's because you can see an immediate change, right? Like it's like that.
yeah.
I guess it's kind of gratifying, or you can see it instantly, like something different. Do you prepare your patients, the moms, on expectations of what their baby would look like after? Because I know that a lot of moms don't realize how different their baby is gonna look.
It really is amazing because I've even observed that to me, the on table transformation, it's almost like they go from a little baby to like a little man or like a little woman. It's almost as though like everything just kind of comes together. And um, so the conversations before the surgery are often so sort of focused on the surgery and sort of the excitement about getting it done, but also, of course, the fears about the surgery that we don't usually talk about that difference that they might notice or like absolutely are going to notice like that big transformation. But I do think that that's something I'm going to implement into my practice because I do really try to think about it from a family centered way and like I really try to make the families feel as comfortable as possible, and I hope they do kind of feel that way. But that's an element I didn't really think much about preparing for, honestly, until I started listening to your podcast.
Yeah, that is like something that I mean, we have lots of groups and stuff, and
Mhm.
that we all talk in, and that's one of the things that they often share is that how they weren't prepared for like not recognizing their baby. Like some people are almost like, is this, can we look at the name, their
Oh, wow.
bracelet? Because I don't know whether do we have the right baby. And because they look so different and they don't realize that they're going to kind of, before, when you get diagnosed, you receive this diagnosis, you're really fearful of what your child will look like when they're born. And then you, of course, you fall in love with this beautiful smile, and then
Yeah.
it is completely changed with surgery. And so people are very like shocked about, wow, like I'm grieving this loss of this different, smile, that now my baby looks different and almost like a new baby.
Absolutely. No, that's absolutely true. And I think the babies are cute, before and after, but like it's that change that
Mhm.
is probably something that nobody is really thinking about until it happens. So I do think that's kind of something to talk about beforehand
Yeah.
because, we talk about like the scar and we talk about these details, but yeah, no, the transformation and the change in their face and smile is definitely I imagine it's a lot.
Yeah, for sure. And I remember going into like my first appointment. I mean, I was a wreck. Like I was literally like, and just a little bit of background about me. So Giselle was born with a cleft palate, so she's
Mhm,
not lip affected. And so
mhm.
I did not know until I had her, and because of that, I was uninformed. There were so many things that, I was behind the 8 ball. I wasn't prepared for any of her care, right? And I was also a first time mom, and so it was just a lot at once. So I was a complete wreck when I got to the office, and there was, the way that the office kind of handled me and really, you know, just they were just very compassionate. And
Mm.
I don't know what they specifically said to me that kind of made me that eased my mind, or that kind of helped. But what do you think are like some things that you share with your patients that you feel like are really helpful for them to know for in that initial meeting, like the first meeting that you have with them?
Yeah. So um, ideally, I will have met the family around the 20-week ultrasound, and that's always helpful. And I have both kind of situations, both the prenatal visit and the surprise visit. And so I'll start with the prenatal. First I ask like what. Well, I'm sure that they have a bunch of questions or concerns. I always ask, like, do you want to start? Or I have a whole spiel if you want me to start. And they often kind of want to hear the spiel first. And so because that just sort of allows them to get what questions they have answered in their minds. And then they can focus on the ones that I didn't go over. Usually, we have a sense as to um, if there's anything else going on in the body or if it's isolated at that point, meaning only the lip and or palate affected. And we also have a sense as to the genetic testing.
Mhm.
By that point, obviously it doesn't cover every gene, but at least like major stuff. So like I always go over the fact that this is the most common facial difference in the world.
Mhm.
It affects 1 in 700 live births. So it's like it's just super common, and it is most often sort of an isolated problem unless we have any evidence otherwise. So, this is something that we can absolutely correct through surgeries, through team based care. I'm really passionate about team based care. We created the Rutgers Cleft team just to really ease the burden on families, to just kind of make them feel like they're not missing anything and kind of to hold their hand through this. And I feel like that's really reassuring. I also share, kind of a personal thing, but my husband actually has a cleft lip,
Mhm.
and so clefts do run in our family in that way. And sometimes that actually just makes them just like I can see a shift as like, oh, this is going to be okay.
Yeah.
And I think it's helpful just to sort of humanize and I mean it doesn't normalize the experience. I don't want to use that word, but it does sort of give a sort of a long term view of it,
Yeah.
if that makes
Yeah, no, I think, yeah, I feel like hearing that, if I would have heard that as well, it would have made me feel, we don't want to use that term like, normal, but it is like a quote unquote, like, oh, this happens, like I'm not, I think one of the things that happened to me is I felt like I was one in a million. I felt like so isolated
sense.
and so alone. Like this is like just happening to me. This doesn't happen to people here. There's something that I did, something that happened, and where
Yeah.
did I go wrong? I think, but hearing that, and yeah, like I think that that would have been something that would have like at least made me feel like to have that long view, or that big picture of like um where could this go. The other thing that I wanted to ask as well is, so in terms of genetics, most of the time people have their diagnosis through their ultrasound, and then is the process usually they're sent to genetics immediately after that appointment, or and then you have that information because they are referred through maternal fetal medicine? Is that how it typically works?
Exactly, yes. And so a lot of these kind of referrals tend to happen all at once. It is helpful to have to stagger the appointment so that I'm just like a couple of days at least after the results come in, because then I can review them, with their OB to make sure like we all have the same understanding and I can answer their questions as accurately as possible.
Mm.
But I've definitely gotten a call saying like that, this family is super worried and would really benefit from talking to someone
Mm.
right now. And I've squeezed them in. Absolutely. So it's all about the pros and cons for that individual family. Hmm.
Yeah. So, because the thing that happened to me as well is so when I arrived, obviously this was all new to everyone, right? Surprise. And I was sent to genetics after that. And my surgeon, she referred me to genetics. So Giselle, she looked at her and she said, oh, she has a small jaw. And also
Hmm.
Giselle had been kind of choking a little bit. And so she didn't say anything there, but obviously I went home and I Googled, and, and I said, oh, okay, she's trying to determine if she has like PRS or,
Hmm.
um, so we were sent to genetics, but they assessed for 20, I think it was 22q deletion.
Okay.
And so I don't know if that also has some correlation with the like small jaw. But my question is, what I've heard of a lot of other parents that say like we didn't see genetics, like nobody referred us to genetics at all. We
Mhm.
just assume that it's isolated.
Okay.
And I'm curious about that. Like what is like are all of your patients, because I know every practice is different. Are all of your patients referred to genetics, or is it like kind of like, hey, after I see them, like what determines that?
Prenatally, I would say they all do, just because we have the access, we have them right there. We're able to do it. I don't know why not, right? Um, Postnatally, suppose it was a surprise, then if it really seemed like there was, nothing else going on, then I might not push the referral,
Mhm.
because especially now that I'm a mom, like I know there's just so much going on in those first few weeks of life, like in the family, with the baby, with the mom, like we've just gone through something.
Mhm.
So I try to think about what is absolutely necessary. I always have a conversation. I always offer. I always say, if you want, we can have uh, like I am not particularly worried, but if you want to have this additional information,
Mm.
we can absolutely help to just sort of establish care and to get any of those questions answered. And a lot of them do take me up on it, but I wouldn't push them, if that makes sense.
Mhm. Yeah,
Hmm.
I mean, I would admit that that was probably one of the hardest appointments. It was like, I mean, not only did we have like countless appointments, like back to back to
Hmm.
back, but I think that I don't know, it was just kind of like the sterileness of it all was very like seeing a genetic counselor and just kind of like looking at like worst case scenario type of thing, and then
Hmm.
also like going down like the hall, and then there's this little like baby gurney. It was like like it was like a lot. And so I had been holding it in for a really long time at that point, but that was the appointment where I really like broke down. But on the flip side, I was really grateful to have the information. And so I do like when moms tell me like, oh, we weren't referred to genetics at all. It is like, well, I would always kind of wonder.
Exactly. And so I always I always offer it. And I would say that, most people take us up on it. And it's, on our end, it's easy enough to put in the referral, to reach out to them and ask them to reach out to the family to set up the appointment. So, it's helpful that we are in a center that allows us to do that. And so it's not a whole thing.
Yeah.
And then I think the families appreciate having the option.
Yeah, I think so too. And then there are some moms that do come back and they say, well, we're going to skip genetic testing because it's not going to make a difference. We're going to
Mhm.
love our child. And that always kind of confuses me as well because I'm like, yeah, of course you will be, but you want to be able to provide them with the best, like you want to know what the what is so that you can provide them with the best resources. But
Right. You don't want to miss anything.
yeah.
Yeah.
That's interesting.
Mhm.
But yeah, no, I love that that is definitely like an option for your patients as well. What surgery schedule do you typically follow for your patients? I know it kind of varies like from practice to practice, but like what is your standard?
Yeah. So for the lip, in the standard fashion, around 3 months. For a super wide lip, I often do it in two stages, as you may have heard about, with the adhesion first and the definitive repair. So the adhesion would be around 3 months, and the repair would be around 6 months. Um, and the cleft palate repair is around 10 to 12 months, closer to 10 in most cases, but there are instances where it has to be a little bit later, if I kind of want to give them a little bit more time to grow and gain weight and
Mm.
sort of be able to withstand the surgery, especially if their palate is really, really wide. From like a technical standpoint, you at least in my hands, if the baby's a little bit bigger, then that just sort of increases the ease of the operation for a super, super wide cleft, for example. And I really just kind of want to, set them up to have a good repair that heals well. And hopefully they can just move on from this,
Yeah.
um, and not have any complications.
Yeah. Do they have, is it like I guess for palate repair in particular, or even like lip repair, is there a reason why 8 months wouldn't work? Like, is it anatomy based, or is it simply because of like the weight of the baby?
Okay. So, um, it does vary, from center to center, but broadly speaking, you want to balance the timing of the palate repair so that you want to get to it early enough where speech is not impacted. Because if you delay a cleft palate repair too long, then they sort of don't learn how to speak or to use the right sort of anatomy to speak, and it's very hard to unlearn that. So you definitely want to do it before 14 months for sure,
Mm.
if possible. But there are kind of situations where, I don't know, for some reason, a late presenting patient, etc., you have to kind of take it as it comes. But as long as the patient's been in your care, you want to kind of get to them within a time, like an appropriate time frame. um, but if you do it too early, then it really impacts the growth of the upper jaw, the maxilla, because
Mm.
it's a lot of dissection, a lot of scar tissue. And as you've probably seen over all of your sort of conversations, there are patients who are impacted where their upper jaw does not grow as much as their lower jaw. And so it's kind of behind their lower jaw, and that increase and the risk of that increases the earlier you do that palate repair. So the timing
Ah.
can't be too early.
Oh no, I did not know that. Okay. So but this can also happen anyway, right? Like if there's a
It can happen anyway.
potential, okay. So because I've seen
There's also
yeah, there are some situations or some repairs where then what do you call that? They then have to have, is it orthodontic?
orthognathic surgery.
Orthodontic.
Yeah,
Okay.
and so that's done at skeletal maturity. When the skeleton's all done growing, but it's just kind of to decrease the severity
Hmm.
of that growth disturbance.
Gotcha.
Is why you don't want to do it too early. Hmm.
Gotcha. Okay. So, in just thinking about, so Giselle is cleft palate affected only, there is a
Mhm.
potential, and also even if she wasn't cleft affected, that this could also be something that it could occur for her.
Absolutely.
Okay.
It could just by nature of just having had an operation so early in life, but the pros and the cons, like sort of the pros of the operation vastly outweigh the cons,
Mhm.
because again, like a major delay in the timing could be problematic for speech.
Yeah. And
Mhm.
so, you mentioned the 2 stage with the lip adhesion and then
Mhm.
then the repair. Do you
Yeah.
do, this in place of the NAM, or do you do both options?
Correct. So we don't have NAM at our center, and so we do offer the two-staged approach. There are pros and cons to NAM, as I'm sure you've heard, and so that's just how we do it at our center.
Yeah. Do you want to have NAM at like, to offer that at your center, or is this something that, like yeah, what's your opinion on it?
I would love to be able to offer NAM at our center eventually, because I want, families to have that option. Ultimately, if they choose or not choose to have it, I think, both options have their pros and cons, like I said, but I just want to have more options available to our families. And so that's something we're talking about and kind of working towards adding. Yeah.
Yeah, for sure. And for lip repair in particular, what is that like healing process like? Like, what should parents expect to see after lip repair in terms of healing, and how should they kind of take care of this area after?
Mhm. So after the lip repair, I place some surgical glue on top of all of the internal stitches.
Mm.
And then on top of that surgical glue, I put some tape, and it kind of looks like they're leaving with a tiny mustache. It's very cute. So they often can't even see the incision for a couple of weeks until all that falls off. In that time, I do have them do the no-nos. But it is very, like, I try not to ruin people's lives. So if they're saying, like, they were so upset with the no-nos, like, I can watch them. I'll say absolutely. It's fine to take them off as long as you're watching them.
Mhm.
And then, just have them wear them at night. I haven't heard too much negative feedback about that at all. But if someone said, like, "Oh, my baby isn't sleeping at night because of the no-nos," then we'd come up with another solution. But we haven't really run into that yet. So,
Yeah.
mhm.
People actually complain more about the bottle weaning than they do about the no-nos.
Bottle.
Do you ask your patients to wean from the bottle before palate repair?
Not necessarily, because I allow them to use the cleft feeding bottles post-operatively. The one with
Mhm.
the disc. It's the Dr. Brown's, or whatever cleft feeder they were using before. So the palate repair is usually done around the time where they are, working on their cup skills and their drinking skills. But I think it is a big ask to have them fully off the bottle. Just personally speaking, I know my kid wouldn't have been fully off the bottle by at that age. But that's my practice. I'm fine with them using the cleft feeder post-op.
Yeah. It was so interesting because we were asked to wean, to just practice with, the free flow cup, which
Mhm.
I am grateful that we did do that. She was still very reliant on the bottle, but it just gave me another option, because what actually happened, and a lot of parents go into this, they're like, "Oh, I'm so worried. I haven't been able to get my child off the bottle, and my surgeon wants me to get her off, or get my kid
Mhm.
off, but we haven't been able to do it." And I always kind of share, like, my daughter afterward didn't want anything to do with the bottle. So
Mm.
we really, like, I'm glad that we had practiced that free flow, or kind of like the syringe feeding, because
Right.
she didn't want anything in her mouth. And she actually
Absolutely.
sucked her thumb as well. So
Mm.
before palate repair, she would put her thumb in her mouth, and that's another thing that comes up. It's like, "Oh, my baby has a passy that they use, or they suck their thumb," and we're really worried about
Mm.
that. Um, having, because they can't have any of that, um, having, because after went right back to it. So
Okay.
once she was all healed up, she started sucking her thumb right away.
Perfect. Yeah. Yeah. I know the babies know sometimes. Yeah, I agree with you. I think it's great to have that skill, to have options post-operatively, as you said, like if the baby doesn't want the bottle,
Yeah.
I think that's great. Yeah.
So I've heard a lot about micro clefts,
Mm,
and some, you know, some parents are like, should we operate on a micro cleft? Like, it almost seems like putting a scar over a scar, or like, just a scar over something. What, I guess, should parents have surgery for micro clefts? And if so, like, why? What's the reasoning behind that?
it's such a personal decision. I would say it's so personal. I think that it's really important that parents know 100% kind of what they're getting into with the operation. So first, especially for ones where the muscle isn't affected, because sometimes because in an incomplete cleft where the skin is all fine on top, but the muscle is affected and the nose is asymmetric, you're definitely still sort of you are repairing this anatomic kind of discontinuity,
Mhm.
and it's definitely worthwhile. They're going to get a scar, but it's in order to fix a deeper problem. I think I think it is important for parents to understand, like if their child just has a little notch, it they may be less happy with they may, in the worst case scenario, be less happy with the scar than the notch.
Mm.
If if it doesn't heal exactly well
Mm.
or perfectly. Like in a perfect situation, it would look great, right? But it's risky. So I would say, talking to their surgeon, making sure that they have all their questions answered, maybe seeing some examples,
Mm.
some old patients. And I'm kind of sensitive to that myself. Like a lot of families want to see pictures of my patients, and I have a few parents who are super like, yes, like plaster my baby's face everywhere to educate and to make other moms feel better. And others are just like, this is
Mhm.
really private. I don't want to do that. And I I'm their surgeon. I don't necessarily want to just like come out and ask every
Mhm.
single one, because I don't want to make them feel like I'm pressuring them. So and so that's like another level to that whole thing.
Yeah. Now,
It's
if the muscle is separated, does that impact, like, I know it probably impacts some functionality, but does it impact speech or the way that you eat?
no, no. Well, I would say if the skin is intact, they're probably able to make a seal. They're probably able to feed. It's probably still a somewhat, you know, uh, aesthetic issue, which is important because it's important, for people to fit in. I would say like I do a lot of incomplete clefts. I do,
Mm.
absolutely. But when it comes to something super like a microform cleft, for example, or like a little notch, I just think it's important to be aware of the pros and cons, if that makes sense.
Yeah. Why do I know another thing that people or parents have trouble with deciding on. For me, it was kind of a no-brainer because Giselle had a few ear infections, and she didn't fail her hearing test, but she had some hearing loss, and they could tell it was like like some fluid buildup. And so I've heard parents ask about ear tubes, and why, is it an automatic thing that people, have to do when they do have a cleft palate. Now,
Mhm.
can you explain just a little bit of why ear tubes are placed during, cleft palate repair, or why children born with cleft are why is it recommended for them to have ear tubes?
Yeah, so kids born with clefts of the palate, their eustachian tubes are often affected because the muscles that are impacted with the clefting of the palate are the same muscles that function to open those eustachian tubes. So these kids are sort of prone to be at risk of having fluid in their ears, and that could impact hearing if not treated or if it's missed. And so it does vary by center. Some centers standardize just to make sure nothing is missed, because so many kids are impacted by this issue, that it's safer to place the tubes. Just place them. They're already undergoing anesthesia, and then other centers will sort of follow the children, see if they develop fluid, develop ear infections, and then place the tubes if they have, for example, 2 ear infections or a history of fluid. But if they have like no fluid ever, then maybe not. So it's just a conversation to have with, your team, your ENT, if there are concerns about placing the tubes or not placing the tubes.
Yeah. I mean, for me, that was kind of a no-brainer. Like, I felt like, I felt like, that's the same reason, like, because they said that she was already under anesthesia, it would help with her ear infections and that type of thing. But yeah, some parents ask about that and just kind of want to know like the purpose of it, to not have like these unnecessary procedures. I think that's a really big concern for a lot of parents.
I get it. I really get it. And I try to, I just try to, at some point, I'll say like, here are the pros, here are the cons. And then I'll share like, if it were my kid, because I have a kid, it's helpful that I have a kid as opposed to like a theoretical.
Yeah.
I'd say if it were my kid, to me, I think I would feel safer going forward in this direction. And I think that that's helpful sometimes. It doesn't mean they have to, but I think it's helpful to have that sort of personal component.
Yeah, that happened to me actually with ironically, when Giselle was going to get her second set of tubes placed, and she had like a minor cough, and the anesthesiologist told me that. He said, if it were my kid, I would cancel. And I'm like,
yeah,
you say less.
Exactly. Yeah. Yeah. Like knowing everything we know, knowing how things could go,
Yeah.
it definitely gives us a new perspective, or a broader perspective. And I would say that if someone told that to me, I'm like, okay,
Yeah.
that's all I need. Yeah.
So I've been really curious about, so, that when I first went to see my surgeon, they identified that Giselle had a cleft palate. And then of course it's how many surgeries is she going to have? And of course we will see, there's never like a definite. And just a little bit like about your like personal life. What are your husband's thoughts, or does he have any opinions on your approach to care, or do you all talk about these things? Do you ask him questions about his personal journey? Like, what is that like?
So it's interesting because I've been with my husband since we were in college. And so this was like long before, this part of my journey, my career. And you would think that I went into it because of him, but it's actually not. And I think it really goes to show that like he's just a guy to me. Like he's more than this diagnosis that occurred when he was a baby, if that makes sense. Like it was actually just my own personal experiences that drew me to cleft care and craniofacial care. So yeah, it's really not a big part of our lives, but I hope that like is a good thing, if that makes sense. Like it's, and and I remember when he was earlier on in our relationship, he would joke about his cleft and say that it made him more memorable. And so that's his experience. Everybody's different. I sometimes share my before and afters with him, and he's like, amazing, I swear. So that's kind of, I don't know the gist of it, but it's not a big part of our lives. But I think that that's a good thing.
Yeah.
I think it means like it is. He's a normal guy, who just had a who happens to have a cleft,
Yeah,
you know?
I think so too. Yeah. It's so interesting too because if you were, I feel like I would do that too. Like you show your before and after is like, what do you think? Like, because you just have someone that has like this lived experience. But I've heard that as well. Just even like parents, right? So my daughter is two, so this is a big part of our lives. But I've talked to
Mhm.
moms whose kids are like 16, 17, and it's like, I remember a day where it was all that I thought about. And now it's like, it
Mhm.
doesn't even really come up anymore because it's not, we're not going to those appointments every week. We're not like,
Mhm.
seeing doctors all the time. We see them probably once a year and, they may be like a suggestion for a correction here and there. Or of course, I know like breathing is like a big thing for adults
Mhm.
who are born with cleft. They tend to have like some breathing issues. And that's like one of the major things that they are like, I wish I could breathe better and that type of thing. So I've heard of that, a lot of that happening, but in terms of it being like the chatter that in the house, right? It's not there really.
Yeah.
But yeah, I love that you at least have, that connection to it, but also it's just kind of something that you've just been generally interested in. I think that that's really important or valuable. Are you going to the ACPA conference this year?
I plan to, yes. I go every year. It's one of the best conferences, in my opinion. I'm biased, but it is a conference where we get to talk to people of all of these different disciplines. And, as opposed to just being like all plastic surgeons and
Mm,
all, craniofacial surgeons, it's like, it's very holistic. And that's what Cleft Care is. It's like, it's everybody working together to kind of give our patients the best care. And so that's my, I don't know, my thoughts on the ACPA.
yeah, I
Yeah.
love that. We'll be there this year. So
Oh,
yeah,
me?
uh-huh.
That's cool.
We're gonna record on site. So I'm really excited about the opportunity to meet so many people and yeah, so I will see you there. That's really exciting.
Yeah,
Yeah.
it's super inspiring. Oh my goodness. Yeah.
And so just in closing, what do you think has been your takeaway just from being in Cleft Care? What's been the biggest lesson that you've learned maybe from your patients? What is something that, this journey has really taught you about life? And yeah, what's a takeaway?
Let me think. This is a big one. um, yeah, I feel like cleft care and taking care of families has just shown me that like babies are so strong. They're so inspiring. And sometimes I'll have like some minor issue and I think about like a patient of mine who's a baby who is like who's gone through so much and are still just like absolutely killing it. And I'm like inspired by them every day. So
Yeah,
um I think this field and this specialty has like just made me a better person, and I hope that I've helped people along the way as well. I'll also say that, I think I've always been a good doctor, but I think that being a mom has made me an even better doctor, if that makes sense.
yeah,
I feel like it was the last piece where I could actually see how my decisions would impact the family,
yeah,
and it's sort of helped me talk about things in an even more holistic way, even though that's always been my goal. So
yeah.
I think that's a strength of mine as a surgeon is that I'm also a mom, you know?
Yeah. Wow, that's like, I always that's been on my mind a lot lately. I think that becoming a mom has made me a better person in general. And I wouldn't have this podcast or this platform and I wouldn't be doing this had it not been for Giselle's journey. And
Mm-hmm.
we started, I know we were having a conversation before we started recording, but um yeah, she's kind of the reason for all of this, and I'm just so grateful that her story has been able to help so many different moms, and that they feel a little bit less alone. They don't feel like the way that I felt when I first received my diagnosis, and so I'm with you with that. Like kids will will change you. You know, they will transform what you thought your purpose was or your reason for doing something. So,
Mm.
yes. But thank you, Dr. Khan, for being on the show today. You were
Thank you. This was
wonderful.
thanks.
And thank you all for listening to the Our Forever Smiles, Cleft Mom Diaries, and Support podcast. Be sure to subscribe and submit a review of the podcast wherever you listen. I hope that you've enjoyed this audio experience. Maybe you cried a little, laughed a little, but more importantly, I hope that you feel a little piece of reassurance and even joy in your journey. Talk to you next week. Hey everyone, it's Laura here. I'm popping in today because I need your help. If Our Forever Smiles has ever helped you, if you've learned something new, felt less alone, or found hope through this podcast, then I'm asking you to help keep it going. Creating this podcast, sharing stories, and building a space where cleft families feel seen and supported is something that I pour my heart into. But the truth is, I cannot do it alone. If we want to reach more families and provide even more resources, we need your support. So I thought of a creative way to do this. For just $2 a month, you can help ensure this podcast keeps going strong. For $5 a month, you'll unlock exclusive Moms in Real Life content, real unfiltered conversations about motherhood and career and everything in between. And then for $10 a month, you can get everything plus exclusive merch to show your support. If this podcast has helped you and you want to see it grow to help other families that are probably facing the very same challenges that you are facing right now, please consider supporting us today. Every dollar goes toward making a difference for cleft families just like yours. And right now, we'll be using the funds to elevate the show for production. So we'll be able to add more video and just get new equipment. And as soon as this community is established and we're able to do more, we definitely plan to go beyond the scope of just this community. We want to be able to support scholarships for new craniofacial surgeons. We want to be able to support global surgeries and just really spread our efforts to continue to make an impact in our community. I just want to thank you in advance, and I'm just so grateful that you all are able to support me and support this community here. And it's definitely something that I'm really looking forward to. The link is in the show notes, and I just want to do a shameless plug here. The Moms in Real Life podcast is so cool, so candid, and yeah, it's definitely something that you'll want to check out. Thank you all again.